PRP hair loss treatments before and after results. In this video, we will discuss a few patients, a real case scenario in which the patients have taken PRP, and we will show the before and after pictures of these patients so that you yourself can assess the kind of results you can expect with PRP for your hair loss treatment. We have been doing PRPs for last almost a decade or so, and we almost do more than 100 PRPs a month at our center at Saraswat Hospital Agra, and we want to discuss about this very important fact and aspect of PRP. Friends, I am Dr. Satya Saraswat, gold medalist plastic surgeon, and with a special interest in hair loss treatments and hair transplants. Please keep watching this video till the end so that you can see the kind of results patients are getting with hair loss treatment by PRP by seeing their before and after pictures. Please do subscribe to our channel to see such informative and useful videos. Now let us start with our first patient. This patient of ours is a 25-year-old male having hair loss and hair fall along with hair thinning more prominently in the crown region, as well as this is expanding coming towards the front, and his front hairs are also thinning and falling. This he has been having for last around 2 to 3 years. He has taken some treatments with the doctors, but it was not very beneficial for him. So when he came to us, in this case also we did his trichoscopy, and we found out that in the crown area his hairs were quite thin. There was a disturbance in the terminal to vellus ratio. There were very few terminal hairs. The density had also decreased. The thickness has also decreased. Along with that, there was a lot of scalp visibility, and his coverage value was less than 5.4. Then we discussed with him in detail about the treatment which we had planned out for them, and PRP was one of the most important treatment amongst all the other things. Then he started taking PRP. Initially he took one PRP every month for 3 months. After 3 such sittings, he started with once in 3 to 4 months PRP, and you yourself can see in the pictures before and after how much improvement he got from the PRP itself, and you can see that the scalp visibility, especially in the crown, is reduced drastically. There appears to be the fullness of the scalp in the crown region, and he told us that his hair fall stopped a lot and his hairs became thicker, much more nourished and healthier with the PRP treatment. He was very happy with the treatment, so much so that he gave us a very positive and a very heartening review on the Google itself, and we are thankful to him for letting us use his pictures so you can see the before and after results in this case. Do like this video, and then we will discuss the patient number 2. Now coming to the patient number 2, a 26-year-old male having predominantly scalp thinning in the crown as well as the mid scalp region. He was having these complaints for some years, and he was already on minoxidil, but which was not very helpful for him. With these problems, he came to us, especially with reduction in the hair volume, a lot of hair thinning, hair fall, and increased scalp visibility, almost the similar kind of picture which we have seen in our first patient. Again, in his case, we started with the full assessment. We asked him to fill a questionnaire about his problems. We did a full assessment. We did all the necessary examinations of his scalp, and then we recommended him PRP for his ongoing hair loss. He also underwent PRP once a month for 3 months, and then after that once every 3 to 4 months. And after around 4 sittings of his PRPs, you can see how much improvement is there on his crown and mid scalp after his 4 sittings of PRP. His hair fall reduced a lot. His scalp visibility reduced a lot. His scalp thinning of the hair sort of reversed. They started becoming thicker, and his hair fall also reduced. He was also extremely happy, and you yourself can see the change in the before and after picture shown on the screen here. If you are looking out for PRP treatment, you want to contact us about your hair loss problems, you can call us at the numbers given below, or you can write down your phone number in the comment section below, and our team will try to reach out to you to arrange a consultation with us so that we can guide you properly about your problem, how you can overcome this problem. The treatment is never the same for every patient. We have to customize it as per your problems, and then we suggest you the treatment accordingly. Before we start with the next patient of ours with the before and after PRP results, we would like to discuss what is PRP, and I'm sure many of you must be knowing it. PRP is a non-surgical treatment, a therapy in which we take out a limited amount of blood from the vein in the forearm, and we take out 10 to 20 ml of the blood. The different clinics have different protocols protocols for that. And this is taken out in a sort of a kit which has a pre-filled preservative solution. These test tubes are then centrifuged at a predetermined speed, and we do a double spill technique at our center. We do a double spin, which means they are spin twice, and after that the platelet rich plasma portion is extracted, leaving behind the RBC portion as well as the platelet poor portion of the blood component. This platelet rich plasma has a lot of growth factors which are then injected directly into the scalp by our team. So these growth factors, when they're released, they act on the hair root cells and then they make them thicker, they decrease the hair fall, they increase the thickness of the hairs and improves the overall hair fall condition. So that's how the PRP actually works, and you can see in this video how the PRP is made and injected. We use a low level laser therapy along with derma roller to increase or enhance the effect of the PRP treatment. You can watch the video given in the link above to know more about PRP. Now coming to our patient number 3, a 45-year-old male presented to us with a severe thinning in the crown region, mid-scalp, and recession of the hairline. The hairline was receding. He basically wanted a hair transplant, but we told him to go for medical treatment first and try it out for a period of 6 to 9 months. Also, his blood pressure was on the higher side, so we asked him to wait for hair transplant before actually trying out the medical treatment. And then we started with a similar regime which we have discussed, once a month PRP for 3 months and then going for a PRP at once in 3 to 4 months. So after 4 sittings of his PRP, you can see how much is the hair thickness in the crown and the mid scalp, and the patient was extremely happy. He wants to continue this more as a maintenance treatment. His hair fall has stopped, his hairs have become thicker, his scalp visibility has decreased a lot. He is also another of our happy patient. He is planning his hair transplant to further augment the hair volume in the crown, because although the scalp visibility has decreased in the crown, but still he wants it to be more fuller and have more hairs. He wants to increase his hair volume, as well as he wants to address the recession or receding of his hairline. Needless to say, he also is very happy with his medical treatment. Now coming to our last patient here in PRP series of before and after pictures, 31-year-old male presented to us with a thinning and hair fall in the front, mid-scalp and the crown area. He is ideally a very good patient for hair transplant, and we told him so, but he wants to take some time for deciding about hair transplant, and he wanted to go with the PRP treatment first, just to see how the things are going to be with PRP. Again, the similar kind of pattern and routine we followed in his case also. In his case, you can see, although there is not much of a filling because his hairs have thinned out a lot and his density also reduced a lot, but still in his case there was a drastic reduction in the hair fall, which is also one of the beneficial outcomes of this PRP therapy, that your hair fall stops. Friends, needless to say that PRP has to be done properly to gain the beneficial effects of PRP. Ideally, a PRP when done, this platelet-rich plasma should have platelets 4 to 5 times the normal concentration. So if your PRP is like normal platelet levels are 200,000 or 2.5 lakh per cubic millimeter of the blood, then it should be around 1 million. That is around 4 to 5 times the normal value. So it has to be prepared properly, injected properly, and then only it is going to be beneficial. If you do it at a clinic where the substandard kits are being used, there is no quality control, then PRP is not going to be of much of use for your treatment. Share this video with your friends or your colleagues or your loved ones who want to know more about and want to see the actual results of PRP treatment in hair loss. If you want to know hair loss treatment for men, please click the video on the left, and if you want to see one of our cases of hair transplant, then please click the video on the right.